in. So we'll look at the past year, 2021, in federal cannabis policy. Last year was the first year of the presidential term. It was also the first year of a Democratic Congress, but we were also reeling from COVID and COVID-related policies that needed to be addressed on the federal level. There was one significant cannabis passage included in the infrastructure bill, the big package that passed in the fall. I don't remember whether it was November or December, but the package that passed just a couple months ago. In the big infrastructure package, they included a provision that allows medical cannabis researchers to access cannabis and cannabis products from retail dispensaries, and then it also allowed other entities to grow cannabis for research other than just the University of Mississippi, where it has come from for decades. So that was the only place researchers could get cannabis before, and now their options are much broader. So in the coming years, I'm really hopeful that we will get to see some robust research that is using products that are actually on the market right now that patients are using, rather than the cannabis from the University of Mississippi, which honestly does not really reflect the kind of cannabis that is on the market right now. So I'm hopeful for the data that we'll get from that research, and I'm hopeful that it also allows more researchers who want to study cannabis the ability to do so. So even though that was the only significant passage for something cannabis related in 2021, it is still major, and we're really excited that researchers now have access to other products. Other bills passed committees. They did not pass in the floor of the House or Senate and were not signed by the president, but because the legislative session is 2 years, these bills are still alive and still moving and have already passed a first hurdle, which is passing the committee. So that includes research bills that would again change the federal policy and rules that researchers have to follow. They have to get certain licenses, big expensive security measures, no matter the amount or what they're testing or researching, and also bills to allow veterans access, to allow the VA hospitals and VA doctors to recommend medical cannabis in states where medical cannabis has passed. Right now, veterans cannot access medical cannabis through their normal channels that they would use for other healthcare, including the VA. And actually, for some veterans, if they access medical cannabis outside of the VA and also receive care in the VA, it can jeopardize the care that they're able to get in the VA, and they could be classified as a drug user under the VA rules, because cannabis is still Schedule 1 at the federal level, which then, if you're classified as that, it creates a whole bunch of other hurdles for accessing other traditional health care, which is a bad thing for anyone, but particularly a bad thing for veterans who have no choice but to seek healthcare elsewhere to get the care that they need. So these are bills that we're paying attention to this year. I'm really hopeful that we'll see more movement, particularly on research and veterans access. These are two areas where the federal government has fallen way far behind, and it is time for them to move on it, and it looks like they may be poised to do so. Because not a lot passed in the legislative session last year, Senate leadership is looking at 2022 for a massive cannabis push. What I mean by a massive cannabis push is it'll be a lot like Build Back Better and the infrastructure bill, where they're looking at a huge package that will cover many, many different areas. Right now, what Senate leadership is thinking is if anything has to do with cannabis at all, whether it's medical, adult use, research, veterans, doesn't matter, that it all gets put into the same bill. So what this means is, on the one hand, it's good because leadership is going to be putting their effort behind passing cannabis legislation. On the other hand, it kind of makes things more difficult because it becomes a cacophony of voices. Everyone who has anything to do with cannabis are all trying to work on the same bill. And it also mixes priorities, particularly between recreational adult use and medical, but then also just a simpler, what's the word I'm looking for, hurdle that we could come across or side effect is, with a big bill like that, it's either it passes or it doesn't. So if all cannabis measures are being added into the same bill, they either all have to be passed or removed from the bill before it passes, or if they all go up for a vote together and all fail, that's the end of all of them. So this is something that we're going to be paying close attention to, particularly because medical cannabis patients, as you guys know, we all have different needs than the recreational side and then the industry side. So we are going to be raising the patient voice, and we're going to be making sure that leadership and Congress knows that patients need to be a priority, and that it's not simply enough to just allow recreational cannabis, because patients deserve and require additional protections for using the medical treatment. It's not recreational for someone who is using this for a medical treatment. And I know I'm preaching to the choir here, but these are things that we're going to emphasize to Congress, and we're going to be in constant communication with them as this goes through, making sure that we best represent patient priorities through this process. At the end of last year, the Safe Banking Act, it was originally included in the NDAA, which is the National Defense Authorization Act. So what the Safe Banking Act would have done, it would have allowed banks to do business with cannabis industry businesses. Right now, they are not allowed due to federal rules and the fact that cannabis is Schedule 1. So that looked like it was poised to pass, and at the last minute, they removed it from the NDAA. The NDAA was a piece of must-sign legislation. It authorizes the national defense for the country. They had no choice but to pass it. So Senate leadership was hoping by including it, the Safe Banking Act, in the NDAA, it would be a quick pass and come into law. But at the last minute, it didn't come to fruition. So what they are doing with the Safe Banking Act is looking to include it in this massive cannabis bill that they're planning for 2022. I know that the sponsors would like the Safe Banking Act to remain its own bill, but we'll have to keep an eye out for that. Another thing I'm going to mention is the Safe Banking Act. I included it just to let you guys know about other cannabis things that have been going on, but the Safe Banking Act is something that we definitely want to pass, but it is not a huge priority for us to put our efforts behind, because there are bigger patient rights issues that are on the table. And there are plenty of people working on Safe Banking Act, and we are really the only ones working on the patient side with medical cannabis. So we need to make sure that where we are the strongest voice, and particularly where we are the only voice, that we are most active there. Then also this year, in addition to many years in the past, I think it's been 8 or 9 years since this was first introduced, the national budget, which passed in December, included a rider, which is just a little provision. It's not a bill of its own. It's literally just a paragraph that they slide in there, and it's called a rider because it doesn't really have much to do with the budget, but it just rides along with the bill to the finish line. And this preserved and improved DOJ prohibition against interference, which I said in a really weird way. So I'll try to make that in a way that sounds a little more normal. So the budget writer prevents the DOJ from interfering in medical cannabis businesses as long as those medical cannabis businesses are following the laws of the state they're in. That has been what the language has been for the past couple of years, and just this past year, it was improved. So now it protects any cannabis business, recreational or medical, also any cannabis patient or any adult using cannabis legally under state laws. It prevents DOJ from coming in and doing raids. So this budget writer was very, very important in stopping a lot of the raids we saw 10, 15 years ago, 20, 30 years ago, if we're going back to California. Before the budget writer was passed, DOJ saw it as their duty to go in and stop these dispensaries. And so what this budget writer did is basically said, we're taking away all your money to do interference on cannabis businesses. So DOJ no longer does that. So at least for another year, this was preserved and improved. And so next year we'll be paying attention to the budget writer again. And it's also my hope that in the future, instead of having this be a provision that we have to pass every year in the budget, eventually it becomes its own law and DOJ is stripped of that line item in their budget permanently, so they can no longer prosecute state legal medical businesses or patients.